No one likes to think about being admitted to the hospital, but imagine in the future having a hospital room that is an intelligent, connected space and is centered on you, the patient.
I just think it's exciting that really telehealth is starting to transform the care delivery model in the acute care space. When we started our telehealth journey 15 years ago at OSF, we started it with the EICU and implementing that. And now we're really coming full circle and going back and doing a lot more work to transform the care delivery model.
That's Jennifer Croland, Vice President and Chief Nursing Officer at OSF HealthCare St. Francis Medical Center in Peoria. And I'm Shelli Dankoff, your host for OSF HealthCare Accelerated. We appreciate you tuning in and remind you to be sure to subscribe, rate, and review wherever you get your podcast. On the last episode of OSF HealthCare Accelerated, we took a look at the Innovation Smart Room that's helping us shape safer, smarter patient care through simulation. It's work taking place at the Jump Simulation Center in Peoria as part of OSF Innovation. But how will all of that work translate to the actual patient? To answer that question and much more, we are joined by Jennifer Croland, the Vice President and Chief Nursing Officer at OSF St. Francis Medical Center in Peoria, and Brandi Clark, the Vice President of Digital Care for OSF OnCall. So about 6 months ago, you two joined for an OSF HealthCare Accelerated podcast about virtual nursing. And that has been rolling along. And at that time, you teased out this little nugget that said, we're getting close to that hospital room of the future and this technology, and it's coming. And we said, when you get closer, we're going to have you back so we could talk more about it. Well, here we are. So what is the current status of this space?
Go ahead.
So we signed a contract with HealthCare AI. They're a pretty robust in-room, smart room technology platform. They started with virtual meeting technology, so two-way audio video to enable virtual meetings. And then in the COVID era, they really transitioned into healthcare, and their platform has grown drastically, way beyond just enabling that two-way audio video connection into several other AI capabilities, as well as some hardware in the patient room and right outside the patient room. We can talk about all of those details. We're so excited about how this is going to impact patients and our mission partners. The whole care team will have an opportunity to interact, and it will improve all of their experience.
I can hear the excitement in your voice, and you're about to jump out of your chair as well. So when I hear you say they're specializing in the healthcare space, what does that mean? What specifically tip them to go, this is a huge need, and why did they go there, and what's included?
Well, I think during COVID, there was a need for virtual care, right? Thinking about how we're doing things differently, whether it be to reach patients where they're at remotely or to just be an extension of our workforce. And I think that's where we're looking for HealthCare to come in. It's really helping connect disparate parts of our workforce together and disparate pieces of technology together.
So walk me through how this will work then, when you say disparate pieces and things. So I'm a patient, I've come in to be admitted. What happens?
So let's talk about what the actual platform is and the sort of pieces of the equipment. So today, when you walk up to a patient room, you're standing in front of the door. There may be a variety of laminated signs on the patient's door saying you need to put on some personal protective equipment, you need to speak to the nurse before you come into the room, some instruction, right, that's specific to that patient. So HealthCare actually will give us the opportunity to do that digitally. So there will be a digital sign that looks like an iPad outside of the patient's room, and it will pull that information straight out of our medical record and know what that patient needs. Also, that will give caregivers, doctors, nurses, the ability to connect into the patient room and speak to the patient without physically going into the room.
Oh, wow.
So if you think about a patient who's in isolation and you have to put on all of that personal protective equipment before you go into the room, and then you get in and the patient says, I need some more water. Yeah. Now I have to take all of that off, go back out, get the patient's water, and then put it all back on to come back in. So it gives an opportunity to have a quick conversation with the patient from the hallway before you enter in. Next, inside the patient room, there is a digital whiteboard. So today, patients have
An actual
A physical,
whiteboard.
yeah, you have that somebody has to remember to erase and update day to day too.
Exactly.
Yes.
So in the future, that whiteboard will all be digital and again, will allow that information to come straight out of the medical record so no one has to remember to update those things. The next iteration of that will be being able to document some of the care that's provided to the patient right on that whiteboard, and it will go seamlessly into the medical record. And then the third piece of equipment is the actual camera and microphone that allows individuals from anywhere across the health system that have access to the platform to speak to the patient, see the patient can see them on their television. So it gives us that ability to provide the two-way audio video connection and a whole lot of AI capabilities for things like fall prevention, pressure ulcer prevention, using that technology in the camera.
So that's all work that's happening today, but we have to actually bring a iPad in order to do virtual nursing in the room. If we have a patient who is a fall risk and needs a safety companion, a telesitter, we would have to bring a camera into the room. But with having the HealthCare technology installed in all of our med-surg rooms, that technology is going to be in every room, making it available at our fingertips everywhere. We spend a good deal of time just shuffling equipment around.
Yeah, absolutely. And as you were talking about, the gowning up, ungowning, I would imagine you can have consults so much easier, or maybe a secondary provider who has to give a little bit of input. But if they can go in and be a part of that conversation with other team members in the room, I have to imagine time management. This could make for much more efficient use of everybody's time, correct?
Absolutely.
Yep. And I think, as we bring the technology in, we want it to be used appropriately. It's not, being installed so that we don't want people to go into rooms at all.
Right.
But let's say a specialist is unavailable to get to a family meeting, and it's really important that we have their input, but they can log on remotely. The technology provides a platform in which to do that.
So Let's go a little bit to the provider side. I want to talk more about the patients in a moment. But so the mission partners who are in there providing the care, training has to be taking place. This is change management. We all love those words in our vocabulary, and it can sometimes be challenging. While this is exciting, how is that going with the training for the mission partners who will use this technology?
Well, training's under development right now. We have an education team from OnCall that's working both with IT on the hardware and then the local team at St. Francis to develop what that education is going to look like. Because our implementation is going to be phased, we can't install the technology in every room all at once. So it'll be a rolling phased implementation. It'll be one unit really at a time, and will be a combination probably of some modules maybe that they need to do, and then really at the elbow training once it gets installed. They're using the technology is very intuitive. And so I think the ease of use is going to make the training and onboarding really easy for that.
We've talked a lot about the fact that this will impact all individuals who go into a patient's room. And the education and training that they need may be a little different. What does the hospitalist need? What does a nurse need? What does the EVS team, the environmental services team need? What does the dietary team need? So that there will be some sort of foundational, what is this technology really for everyone in the hospital who may at any point walk into one of those patient rooms, and then layering on the additional education needed for those individuals who will physically interact with the technology as well.
I have to imagine, though, the buzz among mission partners is getting there, because this would be super cool to be involved with. I have to believe that there may be some trepidation for some people, but others, there just has to be this, okay, this is cool. I want to go do this. Are you feeling that?
I think so. The physical makeup of our patient rooms has looked the same for 40 or 50 years, right? It's a room and has a bathroom. There's a bed in it. There's a call light. We have a TV. And this is just adding on just a very different layer of complexity and resources for our patients and our mission partners to use on a daily basis. And I think it's just really exciting.
Let's now go to the patient side of things. What do you see as the biggest advantage for patients who will benefit from this technology?
Well, I think just with the whiteboard and having the information from their medical record as it's updated, flowing directly into that, having that information at their fingertips, I think that'll help. There's opportunities for patient education that can be done through the television. Is going to be updating our infotainment system on our TVs, because that's going to be a component of this as well. I mean, I think it's going to update our patient experience to the 21st century. No longer will we have analog cable televisions.
Yeah, well, that's a huge thing, isn't it? Well, and I understand they'll also be able to chat with their family members through the smart board that's in the room. Tell me about that.
Yes. So the same technology that allows a virtual nurse, for example, to connect into the patient's room, or a physician, also can allow the patient to connect with their family members who they've selected as well. So that can be just patient to family member communicating, like if they called them on the phone. It may also be, like we talked about, bringing a provider in virtually. You may be having a family meeting and a family member may not be able to get to the hospital. So you can call that family member into that family meeting as well.
And you're not dependent on your smartphone that may or may not be getting good cell service in a room or anything. That just seems huge in and of itself.
Absolutely.
Yeah.
Anytime you say AI, in these days, sometimes that gets people going, oh, here come the robots, here come that. What is your answer to that? Obviously, this is a huge leap forward, but how do you settle those people who could be concerned about it?
Well, I think AI is going to come into healthcare whether we're part of the solution or not. And so I feel like it's better for us to be very engaged in helping to design what that looks like, as opposed to letting the rest of the healthcare industry and technology companies design it for us. And so, as we think about AI, there's already AI that's being used in healthcare today. Brandi mentioned ambient fall technology. That's a great example of utilizing AI to help keep patients safe. So that kind of helps us to better understand when a patient is starting to get out of the bed, even before the bed alarm goes off, which is now weight-based. When they raise their weight up off the bed alarm alarms. But the ambient fall technology really helps to alert caregivers earlier to when patients are kind of getting on the move. When are they starting to swing their legs out? Maybe they haven't removed their weight from the bed, but they're starting to get up independently. And for some of our patients who are a high fall risk, that 15-second warning for our mission partners could help them to get into the room to assist the patient to the bathroom safely, versus the patient doing it on their own and then falling. So we're already using some forms of AI, and I think that that's a very appropriate use case. And then we have to evaluate all the other different pieces and say, does this make sense for us as a ministry to design this for our platform, for our hospital room of the future?
For the fall risk, is it something that, again, a person physically getting in the room is one thing, but can the virtual nurse come on if the person at a fall risk, if they're starting to sense that? Would that come on the screen and they would say, okay, Mrs. Jones, you shouldn't be doing that? Would that be an immediate reaction or more immediate?
It's a bit of a layered approach. So first, the technology is actually able to provide an auditory direction to the patient to
just even the patient hearing it, they're like, oh, yeah, I'm not supposed to do this. Yeah, okay.
Then for those patients who are being, I'm so sorry, being monitored by our safety companions, the virtual fall prevention sitters, those individuals can then come on as well and provide auditory direction to the patient to redirect them not to get out of the bed or the chair. That's another significant value to this technology, is that the technology is able to monitor the patient in either the bed or the chair. Whereas today with a bed alarm, I have to have a bed alarm in both places, or I have to move it. And this fall prevention technology is able to more seamlessly monitor a patient, sort of how they move about in the room.
This really there's been a great strengthening of the OSF OnCall and the hospital. You've been working parallel and strengthening that relationship as we develop these more digital approaches to healthcare. Does this just further move that along?
Absolutely.
100%.
Yeah, because you have the resources.
Yeah, there's people today that are already doing many of these programs. In some cases, like the ambient fall technology, that'll be something new that we're adding. We've done pilots with it before, but it'll be something that we're bringing to all of our med-surg beds. But in the case of virtual nursing, they're already doing that work. In the case of the safety companions, they're already doing that work. But they all exist on different platforms, and we don't have it readily available, like I said, in every single patient room. And so now it's really bringing that level of technology to be available everywhere, saving the mission partners time. They don't have to go hunt down a cart. They don't have to bring something in, and just really creating ease of use.
And that kind of leads into another point I just wanted to bring up, because there will be people who will say, oh, you're just taking jobs by doing this. You're consolidating it. You're giving AI all that stuff. That's absolutely not the case, is it?
I don't know of one job that's being eliminated with this.
No. We can't do all of the things that we want and need to do for our patients today with the resources that we have. So this will allow us to be more efficient, to provide better, safer, more personalized care to patients. It is not at all about eliminating humans. It's about layering in the technology into the way that we work to enable us to be more efficient. This is in no way something that we're just sort of sitting on top of the way that we care for patients. We've talked a lot about how we really need to think about how this reimagines the way that we provide the care. It can't just be a bolt-on. It has to become a part of the way that we do things. So we've already talked about the education. That also then has to be built into all of our new mission partner education, sure, right? Because this becomes then a part of that foundational training and education when you're coming in to the medical center as a new mission partner.
I would imagine OSF HealthCare serves more than half of our hospitals are rural-based. There is a huge need. We've been called to those communities. I can see that this, once it gets fully deployed, now again, we're talking a little bit of time, I imagine this would have to have a huge impact on some of those more rural hospitals that we serve, correct?
Yeah, from a virtual care standpoint, this is a game changer for the rural hospitals who rely really heavily on teleconsult services. We can't hire all of those specialists physically into all of those rural hospitals. We couldn't hire enough. There isn't enough volume to support doing that in all those rural hospitals. And so we do a lot of that today, but to the point that Jen made about bringing technology into the room, we're wheeling telecarts around the hospital. And it's a great option to have, but if we can make that more seamless in the future to enable those virtual physicians to come right into the room without requiring anything of the bedside nurse to enable that, it's a huge efficiency gain in those rural hospitals in the future.
I know we're starting at OSF St. Francis Medical Center, our largest hospital. And I know if I asked both of you, when do you see this being fully deployed, you would both wish it was yesterday. But realistically, what is the timeline for all of this moving forward?
I mean, I think realistically, it's going to be a multi-year approach. It's a significant capital investment that we're making to transform our rooms and to transform how we're approaching care moving forward. And so I think there's still a lot of discernment that has to happen for how quickly, who goes next, where, when, that type of thing.
Yeah, our scope up to this point has been really focused on med-surg. So those general medical surgical rooms. So now we're starting to think about, okay, once we've deployed into all of med-surg at St. Francis Medical Center, what next, right? To your point, there's a play for the rural hospitals. There's also a play for thinking about what about the other areas of a facility like St. Francis? What about the emergency department? What about your intermediate and ICU rooms? What about your pediatrics for the children's hospital? So we're weighing all of those. What are the pros and cons of going one direction versus another versus, a little bit in both directions at the same time? So if we had all of the resources and all of the financial resources, yes, you're right. We would do it all next year. But we're really weighing sort of the true benefit that the health system gets to determine the sequence of what comes next.
So what excites you both? And I'll ask you individually. I'll start with you, Brandi. What excites you most about this whole project and going forward, both for mission partners and for patients?
From a mission partner standpoint, the way that this will serve to transform the way that those mission partners are able to care for patients is really, really exciting. We hear about all of the burden and the burnout on our caregivers who come to work every day really wanting to provide good care to patients. And sometimes there's too much work to be done to feel like they're doing everything as effectively as they want to. And this will serve to make them more efficient in a way that I hope will enable them to feel that they're providing the care that they want to provide to patients. And from a patient perspective, this should give patients a feeling of a much more seamless experience. And you like things that look and feel nice, right? You don't like to walk into a place that feels like everything's old. So I think that just the experience of being able to interact with technology that is so user-friendly that won't require a lot of training for patients. It is, kind of like you pick up your iPhone and it just works.
Yeah.
That's our experience with this technology as well from a patient experience.
Jen?
I think a lot of what Brandi said really rings true for me as well. It's the impact that it's making on our mission partners, the impact, like she said, on our patients. And I just think it's exciting that really telehealth is starting to transform the care delivery model in the acute care space. When we started our telehealth journey 15 years ago at OSF, we started it with the EICU and implementing that. And now we're really coming full circle and going back and doing a lot more work within that acute care space to transform the care delivery model.
You both have been doing nursing for quite some time. Okay, that doesn't mean to sound like you're, no, but you've been involved in nursing for an extended period of time. Anything I've missed asking you about what this means for the world of nursing moving forward?
I think it's a differentiator for us. Not every hospital and healthcare system has this. And so for our current mission partners or prospective mission partners, I think that this could be a differentiator for our workforce and who they choose to be their employer.
Yeah, agreed. Recruitment and retention, I think, will be huge.
Yeah, the coolness factor, just listening to the two of you talk about it. You almost want to be a patient in a hospital, but not really. But the possibilities sound phenomenal. So thank you both for your dedication to this. Brandi Clark, Jen Croland, always enjoyable. So we'll put it on the calendar for like a year from now, and we'll come back and see how it's doing now after it's launched.
Fantastic.
And thank you for joining us as well. And remember, you can catch all episodes of OSF HealthCare Accelerated at osfhealthcare.org/accelerated.